For decades, managing diabetes has largely focused on cutting carbs, taking medication, and diligently tracking blood sugar. While these are cornerstones of good management, what if I told you there's a vital, often ignored piece of the puzzle that could profoundly impact your energy, your comfort, and your protection against severe complications? We're talking about essential nutrients, the specific vitamins and minerals that empower your insulin, safeguard your nerves, and defend your organs. The sobering truth is, many diabetics, especially those of us over 50, are quietly deficient in key vitamins directly affecting blood sugar control, energy levels, and long-term health. If these nutrients are missing, you're inadvertently making your diabetes journey far more challenging than it needs to be. In this video, we're not just offering tips. We're uncovering the top 3 vitamins absolutely essential for every diabetic. If you frequently battle fatigue, unexplained aches, or struggle to stabilize your blood sugar, addressing these deficiencies can be a life-changing step. Stick around until the very end, because I'll also share the best food sources and top-quality supplements to ensure you're getting enough of these critical nutrients every single day. Let's dive in and take control. First, let's turn our attention to vitamin D. For diabetics, vitamin D is significantly more important than most realize. Beyond bone health or immune function, it plays a powerful role in insulin sensitivity, managing inflammation, supporting nerve function, and shielding vital organs. The challenge is, diabetics are naturally more prone to vitamin D deficiency. This is often due to insulin resistance and chronic inflammation, which disrupt how your body processes vitamin D. Additionally, high blood sugar and frequent urination can lead to increased vitamin D loss, flushing it out before full utilization. Many older adults, especially those with diabetes, also spend less time outdoors, reducing crucial sun exposure, our primary source of this vitamin. The situation worsens with age, as the pancreas and liver become less efficient at activating vitamin D. This means even if you get some, your body might not use it effectively. While a blood test can confirm low 25-hydroxyvitamin D levels, your body often sends clear signals. Persistent fatigue, muscle weakness, bone pain, slow wound healing, numbness, frequent infections, and brain fog are all warning signs. Some may also experience sugar cravings, mood swings, or unexplained inflammation. When vitamin D levels are too low, virtually every major system suffers. Fertility issues can arise for both men and women. In men, it can reduce testosterone and sperm quality, while in women, it disrupts ovulation and estrogen balance. Libido can also decline. The nervous system is heavily impacted. Vitamin D is vital for nerve repair and protection, and low levels can worsen neuropathy, increase tingling, and slow reflexes. Kidneys work harder too, as vitamin D is needed for calcium balance, increasing the risk of kidney stones and chronic kidney disease. Eye health also declines, as low vitamin D contributes to retinopathy by allowing inflammation and oxidative damage in the retina's small blood vessels, leading to vision loss. Critically, for diabetics, low vitamin D is directly linked to high blood pressure, arterial stiffness, and plaque buildup, elevating the risk of heart attacks and strokes. At a cellular level, vitamin D acts like a power switch for insulin sensitivity, binding to receptors in pancreatic beta cells to enhance insulin production and release. It also actively suppresses chronic inflammation by lowering pro-inflammatory cytokines, always elevated in diabetics. Another key function is controlling cellular calcium transport, vital for nerve signaling, muscle contractions, and blood sugar regulation. To naturally boost vitamin D, food choices are paramount. Cod liver oil, 1 tablespoon, is the most potent source, delivering 340% of daily needs. Wild-caught salmon, 100g, provides about 130%, while sardines, 100g canned with bones, offer 110%. 2 large egg yolks give 20%, and UV-exposed mushrooms, 100g, contain about 40%. For a more refined palate, Japanese miso-glazed salmon, 180g, delivers nearly 150%, and Norwegian pan-seared cod liver with garlic butter, 80g, provides 300%. If food isn't enough, quality supplements are an option. Nordic Naturals Vitamin D. 3, 1000, 5000 IU is highly bioavailable. Thorne Research Vitamin D/K2, 5000 IU is also excellent, with K2 ensuring proper calcium absorption, preventing arterial buildup. However, some foods worsen vitamin D deficiency. Processed vegetable oils, soybean, sunflower, increase inflammation, hindering vitamin D use. Sugary foods and refined carbs deplete magnesium, essential for activating vitamin D. Excess alcohol impairs liver function, where vitamin D is converted. High phytate grains, whole wheat, brown rice, can bind to minerals, reducing absorption. Correcting deficiency isn't just about supplements. It's a holistic approach involving sun, right foods, and optimal absorption. Now, let's move on to our second crucial vitamin. Next, we address vitamin B12. If you have diabetes, your risk of B12 deficiency is high, and many don't even realize it. The primary culprit is often metformin. This medication, while managing blood sugar, actively impairs your body's ability to absorb B12 from food. Over time, your B12 levels can quietly drop. Compounding this, high blood sugar itself can damage the stomach lining, further hindering B12 extraction. This problem intensifies with age, as stomach acid production naturally decreases, and B12 absolutely requires stomach acid for absorption. The insidious nature of B12 deficiency is that symptoms often creep in slowly, so gradually that many attribute them to aging or diabetes complications. The most significant warning sign is nerve problems, that persistent tingling, numbness, or burning in your hands and feet. This indicates your nerves lack vital B12. You might also experience extreme fatigue, dizziness, or shortness of breath due to B12's role in red blood cell production. Memory worsening, brain fog, or difficulty concentrating are common, sometimes mistaken for early dementia, when B12 deficiency is the true cause. Low B12 impacts almost every major system. For men, it can reduce sperm quality and testosterone, affecting fertility and libido. For women, it can disrupt ovulation and increase miscarriage risk. The nervous system suffers greatly, as B12 is essential for nerve protection and repair. Without it, neuropathy worsens. Kidneys are also affected, as B12 deficiency elevates homocysteine, which damages kidney function and increases chronic kidney disease risk. Vision can decline, as the optic nerve relies on B12, potentially leading to permanent vision loss in severe cases. Crucially, for heart and blood vessels, insufficient B12 raises homocysteine, leading to artery damage, blood clots, high blood pressure, and increased risk of heart attacks and strokes. Racine, at a cellular level, B12 is like your body's essential engine oil, ensuring smooth operation. It's critical for energy production, DNA synthesis, and nerve repair. A key role is converting homocysteine into methionine, preventing inflammation and protecting arteries. For diabetics, B12 is vital for regenerating damaged nerves, alleviating neuropathy, fatigue, and improving mental clarity. Without it, cells age faster, insulin resistance can worsen, and the body struggles to heal. So how do we fix this? Food first, then supplements. Animal-based foods are the only reliable natural sources. Beef liver, 100g, is a B12 powerhouse, 3,500% daily need. Clams, 100g, are even better, 4,000%. Sardines, 100g, provide 350%. And salmon, 100g, 200%. Even 2 large eggs offer 25%. For luxury options, French foie gras with truffle sauce, 150g, delivers 2,000%. Japanese uni sashimi, 100g, a whopping 3,000%. And lobster thermidor, 200g, 1,500%. For those who don't regularly consume these, supplements are key. Jarrow formulas. Methyl B12 mcg, lozenge, dissolves under the tongue, bypassing stomach absorption issues. Thorne Research. Methylcobalamin 1,000 mcg capsule is highly bioavailable, supporting nerve repair and energy. However, some factors worsen B12 deficiency. Excess alcohol damages the stomach lining, hindering absorption. Processed grains, white bread, pasta, lack nutrients and cause inflammation, impairing B12 use. Acid-reducing medications, PPIs, lower stomach acid, which is vital for B12 extraction. Refined sugar and junk food increase inflammation, reducing nutrient retention. If you're fatigued, forgetful, or have tingling, check your B12. Don't wait. Add B12-rich foods and a quality supplement. Your body, nerves, heart, and energy will thank you. Finally, let's discuss folate, or vitamin B9. For diabetics, folate is a crucial nutrient often overlooked. Your body doesn't store it long, requiring constant replenishment through food or supplements. The problem is, diabetes complicates folate absorption and utilization. High blood sugar causes chronic inflammation and oxidative stress, disrupting folate metabolism. Metformin is another factor. It blocks folate absorption in your intestines, causing levels to decline even with a folate-rich diet. Frequent urination in diabetics also flushes out water-soluble vitamins like folate, making maintenance challenging. Folate deficiency often mimics common diabetes symptoms: unusual tiredness, muscle weakness, slow wound healing, brain fog, forgetfulness or concentration issues, often mistaken for aging. But critically low folate can lead to anemia, meaning insufficient red blood cell production, causing pale skin, dizziness, and shortness of breath. Folate is essential for DNA synthesis and cell repair. Deficiency slows regeneration, increasing oxidative stress and inflammation, issues diabetics already face. Folate deficiency affects nearly every major system. For men, low folate damages sperm DNA, impairing fertility. For women, it's vital for egg quality and hormone balance, and deficiency raises miscarriage risk. Libido can suffer, as folate is linked to blood flow and nitric oxide production. The nervous system takes a major hit, as folate is needed for neurotransmitter production, leading to worsening neuropathy, brain fog, depression, or memory loss. Kidneys also suffer, as folate helps regulate homocysteine, which can damage kidney function. Eyes are affected too, as folate plays a role in circulation and reducing oxidative stress in the retina. Critically, for heart and blood vessels, insufficient folate raises homocysteine levels, damaging arteries, increasing blood pressure, and elevating the risk of heart attacks and strokes. At a cellular level, folate is your body's cellular construction worker, repairing DNA, supporting cell division, and producing red blood cells. It's essential for regulating gene expression and powerfully reducing inflammation, a key for diabetics. Folate even improves insulin sensitivity, helping stabilize blood sugar. Another crucial role, it keeps blood vessels flexible, preventing stiffness, a common diabetic issue leading to circulation problems. Without enough folate, cells age faster, heal slower, and weaken, worsening long-term diabetes effects. So, how do we fix this? Food first, supplements second. To naturally increase folate, focus on leafy greens, organ meats, and legumes. Beef liver, 100 g, is the richest source, 140% daily needs. Cooked spinach, 100 g, provides 65%, cooked lentils, 100 g, 90%, cooked asparagus, 100 g, 35%, and a medium avocado, 25%. These are easily absorbed and packed with blood sugar-regulating nutrients. For gourmet options, French duck liver, pâté, 100 g, offers nearly 200%. Italian truffle-infused risotto, 200 g, 120%, and Japanese miso-marinated black cod, 180 g, 100%. These not only boost folate, but also provide antioxidants fighting insulin resistance and inflammation. If diet isn't enough, supplements can help. Crucially, choose methylfolate, not synthetic folic acid, as methylfolate is already active and absorbed more efficiently. Thorne Research 5-MTHF 1000 mcg capsule is highly absorbable. Pure Encapsulations Folate 800 mcg capsule also uses methylfolate for maximum benefit. Be aware of factors that deplete folate. Processed grains, white rice, bread, pasta, lose folate during refining. Excess alcohol damages folate metabolism. High sugar diets increase oxidative stress, burning through folate faster. Crucially, medications like metformin and antacids block folate absorption, which is why many diabetics need supplements. If you're diabetic and experiencing fatigue, nerve issues, memory loss, or poor circulation, prioritizing folate is key. Adding folate-rich foods, choosing the right supplements, and avoiding absorption blockers can profoundly protect your nerves, heart, and overall health long-term. If you found this video helpful, please hit the like button and drop a comment below. Let me know which of these vitamins you'll focus on. And if you're serious about taking control of your health, don't forget to subscribe. We have more game-changing diabetes management tips coming your way. Thanks for watching, and I'll see you in the next one. Take care and stay healthy.